So welcome back everybody to the weekly Holistic Actions webinars where we help you put all of the symptoms of your pets into context and then interpret them holistically. I'm Dr. Jeff Feynman. Dr. Sarah Fox-Chapman is here today, and we have an esteemed presenter tonight that I will introduce in a minute. Basically, it's just a super duper honor for me to welcome a world-renowned internist, actually the head of internal medicine at Cornell University, vet specialist here in Stanford, Dr. Marnin Forman. Thank you, Dr. Forman, for being here with us. Dr. Forman graduated from Texas, I believe. Yeah, Texas A&M, you just told me. Then did his internship at Animal Medical Center in New York and got wooed over to UC Davis, the vet school over in California at UC Davis to do a residency in internal medicine and fellowship in internal medicine. So he is incredibly well-versed in all of the best of both worlds, or best of one world, and we're here to take the one world and help put it in the more holistic context, because that's what we always really want you guys to do, is take all of the best information of the conventional world and then decide what to do based on all the other information. So Dr. Forman, thank you again for being here, and take it away.
Well, hello, everyone. I'm so thrilled to be here. I was eager when Dr. Jeff approached me to talk to your group to do it. I always enjoy these sessions, and I think Dr. Jeff kind of gave me I think I'm blushing with the intro. I think it's a bit much, but thank you. I'm going to start by sharing my screen and hope this all goes okay. So this talk, what I was telling Jeff before, it's tricky for me because I've given talks before to different groups of non-veterinary groups, and some of the talks have been on like old dogs or cats, or there was this one men's group that I remember giving a talk to, but this one was tricky because it's on a disease process, right? And to some degree, when we start getting into disease processes, the way that I was trained, a lot of it gets into discussions of hormones and jargon and things of that sort. So I'm going to give this a try, and I'm very eager to hear you guys' feedback at the end of the talk, or you can boo during it if it's really going bad, but to give me your feedback on how it goes, all right? And the way that this is going to work is that there's definitely a lot of these slides that are going to be kind of higher level, but it's more just to give a taste of what is going on, and then hopefully I'll be able to explain it. And then if I run astray and I'm doing a bad job explaining it, or you have more questions, that's what the chat feature is for. And Jeff and others, and I think Sarah maybe too, are going to help me out from that point of view. So here's my kind of cutesy, can I have a little sugar and a glass of water? And we're going to talk about Cushing's, Addison's, and more. So when we talk about endocrine disorders, it's actually remarkable how complicated the body is and how many different, if you split them up into endocrine organs, there are. All right. Some of them we think about all the time. Some of them we may not think of. The thyroid gland is one of those ones where people think about because of the frequency of thyroid problems in people, thyroid problems in cats and in dogs. But then you have others like the adrenal gland, the pancreatic beta cells, so one part of the pancreas, the parathyroid gland, these little minutia glands that are right next to the thyroid, that are super important in controlling calcium and phosphorus, the pituitary gland inside the brain, and then the ovaries and testes, which in a lot of our patients, they are neutered or spayed, and they don't have those. and that endocrine gland is removed. And these glands produce tons of hormones, right? And we're not going to get into the hormones, and this list isn't even complete, right? But it produces tons of hormones, but you can test for these hormones. And a lot of the times we are testing for these hormones, and we're testing for them when we see certain collection of clinical signs that fit a pattern, all right? So for a lot of the diseases that you're seeing in blue on the right, doctors are trained to recognize patterns, right? And some of these diseases have really unique patterns that we see over and over again. And when we see that pattern, we start thinking about a disease. So how does that link to what we're going to talk about today? So this is how we're going to do it. For each case, there's going to be 2 different cases. I'm going to present the case to you almost like you were standing in a veterinary clinic and watching us work, right? Where you would see a doctor talking to a doctor, or maybe a doctor talking to a client, and then they collect information and then they go with it. And they start to try to figure out what's going on with the pet, right? So we talk about signalment. This is how we describe a pet, a dog or a cat. Their age, what their neuter status might be, their breed, and then kind of what we call a capsule history. It's like the quick little elevator ride discussion on what's wrong with your pet, right? Not like the full drawn out every last detail, but kind of like, this is what I really am worried about with my pet. Can you figure it out? Then some quick little tests that we're going to do. We're going to do a physical exam and then some tests. And then we're going to dive into what we think might be going on at that point. All right. So here's Jessie. And I will tell you all the pets, that's actually their picture, but it's not their name. So I've changed all their names to kind of protect, the privacy of the pet owner. But these owners did give me permission to use these cases. So this is Jessie, an 8-year-old female spayed lab, right? And this owner came in and literally I went into the record and I kind of tried to pull out exactly what the owner said to us, right? And this owner said, I think my dog may have had a seizure. She's never had a problem like this before, all right? So we did what we call a quick PE. It's like our quick exam. We're looking at them and we're trying to figure out, can we look at that pet just with our eyes and figure out, did she have a seizure? Is she having a seizure now? Why did she have a seizure? So when we looked at her, and I will say this didn't come in to see me, it came in to see another doctor. They took her temperature, it was normal. They checked her heart rate, and this is an 8-year-old lab, and the heart rate's 120 beats per minute, BPM. That's kind of quick for a lab. They usually have slower heart rates than that. And then the RR, that's respiratory rate, how fast they're breathing. And this lab was breathing quite quickly at 60 breaths per minute, but not strikingly, wasn't like having a hard time breathing, just quicker than normal. So then we looked at the gums to see if the gums looked abnormal, and they were pink, just like they should be, and they were moist, hydrated. And then we did what we call a CRT, a capillary refill time, and it was just like we would expect, 1.5 seconds. So when we looked at the pet, there's really nothing striking on the exam, and it wasn't seizuring when we were seeing it. So this doctor decided to place a catheter and then did what we call StatLytes. So StatLytes is a blood test. So I'm putting up the blood tests now, and they're just a mixture of numbers, right? But what I will tell you is that there's one number that really stands out, and that's that GLU. I don't know if you can see the G, it looks blurry to my eyes. GLU, which is glucose. And a dog's glucose should be definitely above 60. Really, it's usually between 80 and 120. So that's a really low glucose. And when you have glucose that low, a pet can have a seizure, right? So this doctor, and when they took this case, they were like, all right, I have a good sense of what's going on with this pet, all right? If you have your eagle eyes there, you can also see that, this happened in 2011. So admittedly, this was a little bit ago, but it's still valid even now.